coronary artery blockage is when plaque builds up in the arteries that provide blood flow to the heart.
Okay, to start the blood flow of the heart, starting with the deoxygenated side, the blood will flow through the vena cava and enter the right atrium. The blood will pass through the tricuspid valve and then reach the right ventricle. This is the back side. And then it will get forced through the pulmonary trunk, passing through the pulmonary semilunar valve and exiting through, as you can see here, the pulmonary artery. Then when it has reached the lungs and is oxygenated, it will come back in the pulmonary vein and enter the left atrium, passing through the mitral valve and then going to the left ventricle. Through the left ventricle, it will pass through the aortic arch and through the aortic semilunar valves. And then it will pass through the three main branches that you'd see on a human. This is a pig heart, so it doesn't have three, but it'd go on the right side, the brachiocephalic, the left common carotid, and the left subclavian. Just the general anatomy of the heart and how it supplies blood to itself. In the aortic semilunar, there are holes that become apparent when the heart is relaxed and the blood has a tendency to want to go backwards. The aortic semilunar valve catches it, and the holes here supply blood to the rest of the heart through the coronary arteries, seen here on the right coronary artery and the left on this side. Within the heart itself, there are the chordae tendineae, which are the fibrous tendrils that connect the valves to the papillary muscles, which are these rounded bumps that anchor the chordae tendineae and keep the valves in place.
Coronary blockages can also cause myocardial infarction, also known as a heart attack. The symptoms of this are angina, which is a squeezing, painful chest pain, jaw pain, neck pain, arm pain, especially reported in the left arm, nausea, heartburn, clamminess, lightheadedness, and other more unusual symptoms that can vary from person to person. Depending on the severity of a blockage, where it is located, or in the gender of the person that is reporting these symptoms, they may be severe or barely noticeable. Some people have myocardial infarctions where there are almost no symptoms, and the blockage may not be detected until a later, more severe episode. One of the most dangerous kinds of coronary blockages are those that occur in the left anterior descending branch of the coronary artery system. Full blockages in this area can cause death within minutes, and many of those afflicted will not know what is happening until it is too late or will cause sudden death. Partial blockages may cause angina, but severe cases may leave the sufferer without any time to realize what is happening. People with these, often called widowmaker infarctions or widowmaker heart attacks, can still survive if there are proper medical professionals treating them.
Once the inner wall of an artery is damaged, fatty deposits made of cholesterol and other cellular waste products tend to accumulate at the site of injury in a process called atherosclerosis. If the end of the plaque breaks or ruptures, blood cells called platelets will clump at the site to try to repair the artery. This clump can block the artery, leading to a heart attack. To diagnose coronary artery disease, doctors will ask questions about your medical history, do physical exams, and blood tests. Some of the other tests that are important that they might do are an electrocardiogram, echocardiogram, stress tests, angiogram, and computerized tomography, which is basically a heart scan.
Coronary artery disease and blockages can be caused by a wide variety of factors. Some of the factors that are pretty much impossible to control include age, gender, and family history. Men are at a higher risk of this disease than women, and the older you are, the higher the risk is. People who have many family members who have coronary artery disease and blockages are at risk. Some factors that are easier for people to control include lifestyle, such as living a sedentary lifestyle. Diets high in LDL cholesterol increase the risk of fatty deposits in the arteries. Obesity and hypertension are also two important factors that determine one's risk for cardiovascular disease. Other factors include being a smoker and having diabetes. Managing and treating hypertension and diabetes are important factors to reducing one's risk. Researchers are now researching other risk factors to see if coronary artery disease may be predicted through ways that are not considered traditional. People who have autoimmune diseases, such as lupus, may be at higher risk for coronary artery disease.
There are many different treatment options that are available. Lifestyle changes like regular exercise and healthier eating both promote healthier arteries. There are also many drugs that can help. Cholesterol-modifying medications decrease the LDLs that typically deposit in the arteries. Aspirin is a blood thinner that prevents clots, and beta blockers decrease blood pressure, which decreases the heart's demand for oxygen and reduces the risk for future heart attacks. However, surgery is often needed to help this situation. During an angioplasty and stent placement, a catheter is inserted into the artery, then a wire with a balloon on the end of it. The balloon is inflated and compresses everything against the wall, restoring blood flow. A tiny metal stent is then placed in the area to keep the artery open. In coronary artery bypass surgery, a vessel from a different area of the body will be taken and then put in the heart to reroute blood around the blockage.
Coronary artery disease can be prevented by eating healthy and living an active lifestyle, as well as seeing your doctor regularly.